by the constitution, social sectors and especially health were provincial subjects. But due to a constant source of interference by the federal government and the Ministry of Health, the provinces were complaining about lack of autonomy to make decisions, etc. So under the 18th Amendment, what the federal government in consultation with the provincial governments has done is that they have given the powers as to all issues related to health. Now, 18th Amendment brings opportunities for the provinces because they now have the financial. First of all, let's start about with the finances. Under the National Finance Commission Award, they have the resources, but they also have now a clean table, a clean slate in front of them where they can plan and make strategies for themselves. And they can invest money more into primary health care as compared to tertiary care as they were doing before. The federal government, what it has done is it has given away all its powers to the provinces, but that pertains only to the vertical programs. When it comes to other functions of the Ministry of Health, which got dissolved, rather Pakistan is the only country in the world which doesn't have a federal Ministry of Health. Other functions related to international relationships went to Economic Affairs Division, Planning and Financial Disbursements went to Planning Commission, and other divisions of the ministry. This has created a vacuum because the provinces do not have the capacity and the knowledge on how they are going to interact with the donors. How will they respond to the international donor commitments? So we are lying between something called a state of confusion, chaos, and we don't know whether we will collapse. But as the health indicators tell us, we are not making progress to anything. We are investing into health, but our outcome indicators are not improving at all. What the provinces need is to have a leadership which has vision, a leadership which emits from the political constituency and comes down to bureaucracy. It is not what they want to show, rather what they should do is the question. They're not interested in what they're going to do. My feeling is that they're more interested in who is going to do it. Now that creates a power turf. Now governance is the crux to the whole thing. Now governance is about what are the things to be done and how are the mechanisms going to take place and what are going to be the kind of strategies that are going to be placed in, what are going to be the financial implications to it, and how are they going to reach out to the people. Now what the provinces need right now is to have a clearly laid down prioritized strategy which is based on international commitments but also on the current burden of disease. They know what their burden of disease is, they know what the international commitment is. They just need to put it down on paper and then don't do it for a term of 3 or 5 years. They need to have a vision for about 10 years, and so that there should be a continuity. Because the health department, like any other department in Pakistan at the provincial level, is subject to transfers. So any new person who comes in to lead the sector has his or her own mindset. But if the health department has a strategic document, has a vision on which they are going to follow, then yes, new innovations can come, but they still continue to work on it. They need to prioritize which districts to go to first. They need to prioritize what interventions are to place. They need to prioritize where and how the money is to be put in. That's what the provinces need to do. Well, the MDGs are definitely going to end. There is consultation going on at the international level led by the United Nations on what will happen after the 2015 when the Millennium Development Goals come in. There are two current approaches to it. One is to continue or extend the current ending date of Millennium Development Goals. The second one is to replace it by another set of goals for sustainability, which is another high-level commission formulated by the United Nations. What is Pakistan going to do? Is Pakistan going to sign another one? That's what my very honest opinion is. Pakistan is not going to go and play an active role because they have not done it so far. That's what the history says, obviously. But within Pakistan, It is time for the provinces to come, coordinate, and start thinking on this international level agreement that they might have to sign one day, and give a feedback to that forum, be prepared for it, which we normally are not. So that's what's going to happen to MDGs. We are, by the way, Pakistan is not on track to meet its MDG goals. We are way behind. You see, the mindset is linked to the finances. It's professional incompetency, it's financial corruption, it's the lack of capacity to visualize, and the utmost need to retain their seat, their power. That's the power turf. Now, how are we going to do it? We need to go back to where the problem arises. You know, one day Albert Einstein said that the problems we face today cannot be solved by the same level of thinking that created them. So it needs a whole set of interventions, which is going to be a long term. It's going to be medium to long term intervention, whereby we go and sensitize the politicians. But the ones who are responsible for policy planning and for strategic vision, which are the bureaucrats, I think we need to go down to their basic schools of management, and then introduce this whole issue of outcome-based management, governance, and also then go to the technocrats and empower them with the will to advise, which they fail to do and have failed to do so far, because they sit in front of the bureaucracy and they are, as we say, the man of the principle, you know, not with the PLE but with the principle PRI and CIPAL. Whatever the top notch says, they say yes. So it's not an easy thing to do, but it can be done.